Thank you, sir. We now commence the prestigious award ceremony felicitating the top scorers of our batch in the final MBBS Part 2 examinations conducted by the Kerala University of Health Sciences. I first invite Dr. Sudha Balakrishnan, Professor and Head, Department of General Medicine, onto the dais to give away the gold medal for the topper in General Medicine. The gold medal in General Medicine is awarded to Dr. Ashwin Valliod, who scored 236 marks.
Thank you, ma'am. Next, I invite Dr. Purushothaman, Professor and Head, Department of General Surgery, to give away the gold medal for the topper in General Surgery. With a score of 225, the gold medal in General Surgery is awarded to Dr. Ashwin Valliod.
I now invite Dr. Ajit, Professor and Head, Department of Obstetrics and Gynecology, to the dais to give away the gold medal for the topper in Obstetrics and Gynecology. Having scored 148 marks, Dr. Ashwin Valliod is the winner of the gold medal.
Thank you, sir. Next, I invite Dr. Mohammed MTP, Professor and Head, Department of Pediatrics, to give away the gold medal for the topper in Pediatrics. With a score each of 76, the gold medal is shared by Dr. Ashwin Valliod and Dr. Anu Paul.
Thank you, sir. I now invite the esteemed chief guest, Dr. S. Sudhindran, onto the dais to award the gold medal for being the overall topper in the final MBBS Part 2 examinations. With a total score of 685 marks, the gold medal for the overall topper goes to Dr. Ashwin Valliod. Congratulations, Dr. Ashwin.
Congratulations to Dr. Ashwin Balyod and Dr. Anupol on your great achievement. Now, for the awarding of the prestigious 4th TKC Memorial Gold Medal Examination winners, instituted in memory of the late Dr. T.K. Chandrasekharan, Professor and former Head of the Department of General Medicine. A gifted academician, beloved by students and colleagues alike, the Gold Medal Examination seeks to honor this great mentor's memory. To give away the certificates and medals, I invite Dr. Sudha Balakrishnan, Professor and Head, Department of General Medicine, onto the dais. Ma'am, please.
First, I call upon the finalists of the 4th TKC Memorial Examinations to receive their certificates. Dr. Annalise Matthew.
Dr. Reshma Thomas.
Dr. Urmila MG.
Dr. Vishnu V. Mavur. Congratulations, doctors. Now we have the winner of the 4th TKC Memorial Gold Medal, Dr. Ashwin Balyod. I invite him onto the stage to receive the medal and certificate from Dr. Sudha Balakrishnan. Congratulations, Dr. Ashwin.
Thank you, ma'am. I now invite Dr. Asha A.V., Professor, Department of Ophthalmology, to give away the cash award of Rs 10,000 instituted by her in memory of her late husband, Dr. T.K. Chandrasekharan, to the winner of the TKC Memorial Examination, Dr. Ashwin Balyod. Ma'am, please.
As a token of immense gratitude and appreciation to our chief guest for gracing this occasion, I call upon Dr. M.K. Balachandran, Medical Superintendent, KCHC Pariyaram, and Sri M.V. Jayarajan, Chairman, KCHC Pariyaram, to present Dr. S. Sudhindran with a memento. Sirs, please.
We now call call upon our chief guest, Dr. S. Sudhindran, to please come forward and officially release the profile book and CD of the 2010 batch. Sir, please. Thank you, sirs.
We now move on to the felicitations. First, I call upon Dr. Balakrishnan Vallu, Professor and Unit Chief, to address the gathering. Sir, please.
Respected Principal, Academy of Medical Science, Professor K. Sudhakaran, respected Chairman KCSC of Pariyaram, Sri M.V. Jayarajan, respected Chief Guest of the Day, eminent vascular surgeon and transplant surgeon, Professor Sudhindran of Amrita Institute, respected Medical Superintendent, Professor Balachandran and Professor Pramod, the coordinator, dear senior faculty members, head of the department, dear friends, colleagues, students, ladies and gentlemen, it's a great privilege and pleasure for me to offer a felicitation to these outgoing students of 2000 batch. And it is a dream come true for them. The long cherished ambition of these students, their parents, their hard work, sleepless nights, motivation, all leading to this great victory, and today mark a turning point in their life. And I would like to join with them on their happiness. The glittering ceremony, this graduation ceremony, the pomp and the august audience which are present here is also of the organizing and the teamwork of the 2010 batches. And this they have shown throughout their course at Academy of Medical Sciences, Pariyaram. They participated in all the activities of the Department of Medicine, and they made our department vibrant, and we moved along with them, and we really enjoy their presence in the Department of Medicine. And I congratulate you, the graduates, on behalf of the Department of Medicine, on my own behalf. Behind the scene, there are a lot of people who are silently praying, and they also had the dream that their children became a doctor. They wear the gown and the cap and the degree and get the degree. And they always prayed. They moved their mind along these graduates, and they are none other than the mother and the parents. And probably these students may be remembering 6 years back that their parents are taking these students from center to center, from colleges and colleges, in pursuit of getting a good education for them. Today, again, it is a memorable day for the parents, and I would like to congratulate these parents for becoming or fulfilling their dreams, and I also congratulate each and every one of the relatives who stood behind the students during this period of their academic activities. And as you know, the MBBS course has got the most difficult and long curriculum in any course, and they have achieved only with the support of the parents and relatives. Though may not be, and I would like to again, this young troop as our eminent chief guest and other people, other teachers who has addressed you told, these students with the little knowledge of +2 came to our campus, the vast and serene campus of Academy of Medical Sciences, Pariyaram, nearly 6 years back. And they jumped from department to department during this hop and hope journey. The learned teachers and experienced teachers of Academy of Medical Sciences instilled knowledge into their ears. And gradually they transformed to doctors. And if you go back the history of medicine and you believe in mythology, whether facts or fiction, the Apollo, the Greek god Apollo was the god of medicine. And his son Asclepius was the first physician who started an asylum or SLPO in the old Greek provinces, which have gradually transferred into hospitals. And the father of modern medicine, the Hippocrates, also has get the initial training in this SLPN, and probably later on, the present day modern medicine and its transformation has occurred in the early 1770s, and it is the father of modern medicine, the William Osler, who has transformed and introduced the system of present day medical education, which we all follow all over the world. And what I feel during this journey or during this period from, if you believe in Apollo or whatever, it's even the initial auth of the graduacy is in terms of the god Apollo, later in terms of Hippocrates, and now we follow the Geneva oath, whatever it is. If you believe in it or not, several thousands of teachers has carried this light of knowledge. They transferred to the students, and as you see the candlelight ceremony which you now witnessed, probably this knowledge is transferred from teachers to others, and it is continuing. And I feel, and this is all due to the learned and experienced teachers, and I salute these great teachers of Pariyaram Medical College as a parent, and as you know, I was a parent of one student, and I would like to, I salute these great teachers for the knowledge they instilled into all these children. And as a colleague, I congratulate my colleagues for bringing another batches of doctors who will, as our chairman has mentioned, will go into the society and will serve. And as a colleague, I also share the joy with you. And I don't want to take much time. In a short period of time, these young graduates will fly far and wide from Pariyaram or from this campus. And your president has went into nook and corner of the world, and the products of Pariyaram Medical College is working all over the world in the short period. But as our eminent, the chief guest has mentioned, I too have some apprehension. The apprehension is that the affluence and the change in socio-economic scenario of the society is making some mindset among the doctors and also among the public. The public by and large feel that the new generation doctors or even the doctors like us may not be knowing anything, or they don't trust the doctors. On the other hand, the new generation doctors especially feel that this public don't know anything and they have got ulterior motives and they will not appreciate they are our enemies. And this open up a new area of confrontation. And probably my apprehension is that this is the area which you are going to face very much in the years to come. And you should change your attitude, or you should be prepared for that, and all in an advice from the teachers like us or others cannot change. Either we have to have a change in the mindset of both the doctors and the people, then only probably this sort of problem will be changed. Another area which I want to I have a concern on my student is that the rapid proliferation of the knowledge and the imbibing the knowledge, adapting to you, and developing a core competency in your field of medical education and in the management is a very difficult thing, even for the most shrewd and hardworking students. The proliferation of the biotechnology, the bioinformatics, and also the genetics, and newer medicine, newer disease also being coming, and it is very difficult for any doctors to cope up with this change in trends. And I think this will be another area which you are going to face problem. But I'm sure that the best training you have got and you as a batch of 2,000 students of this Pariyaram has got the efficiency and also the adequate training. I'm sure that you will cope up with any challenges which will come to your way in your future life. Now, as the old Chinese medicine, probably which I might have discussed several times when I used to talk about the history of medicine and other things when I take classes. The old Chinese concept is that there is, if there is a light, there is a dark. If there is a happiness, there is a shadow. If there is a height, there is a low. If there is a left, there is a right. Similarly, if there is a get-together, if there is a meeting, there is a departure. And I feel this is the time to depart for the 2000 batch student of Pariyaram Medical College. And I have the nostalgic feeling. I saw you as small children. Probably you might have heard my firing. Sometimes I send you to the hostel and other things, taking the knee hammer and all those things. But I think you will appreciate that all helped you in the examination hall. Whatever it is, I remember you going back, and I saw your sadness. I enjoyed your enthusiasm in the department, and I saw you all your vibrancy in the, and you people made the Pariyaram more vibrant. What will be the college without you? So I feel a little bit of nostalgic. But I'm sure that you have to move. But I'm sure that you will flew far and wide. You will carry the light which you got. You will serve the society. And I don't want to extend my speech because there are other programs waiting. So I take this opportunity to thank you, all the students of 2000 batch who supported in our Department of Medicine. And I wish you, and I pray the Almighty, the God, to bless you in all your future ventures. And I also would like to wish you all the best in your professional and personal career. Thank you, my dear students. We will see you again. And you will be the proud alumni of Padiana Medical College, and we welcome you back as our PGs again and again. Thank you very much.
Thank you, sir. Next, I invite Dr. Ajit S., Professor and Head of Department, to felicitate the graduates. Sir, please.
Respected dignitaries on the dais, off the dais, parents, dear young doctors. First of all, I would like to congratulate you for this achievement. And I only want to stress 3 points which already mentioned in the previous talks. First is, already told by the Balendran sir, now you are accountable. You have to take the responsibility of your action. When you see a patient, properly document everything and make a signature on it. If you put a signature and you write your name, that means you are taking responsibility of your action. Then you will do the right thing. Before treating any patient, make a provisional diagnosis. The second point is, that is stressed by our chief guest. When you treat a patient, just imagine that it is one of your close relatives. Show empathy to the patient. And most of the time, the people want not doctors, they want the healers. So be empathetic. The third point is, that is raised by Gopalakrishnan sir. Actually, the doctor is, he should have the knowledge also. So you don't stop learning, continue reading and continue learning. So these are the 3 points I would like to tell you. God bless you. Thank you very much.
Thank you, sir. I now invite Dr. Muhammad MTP, Professor and Head, Department of Pediatrics, to say a few words. Sir, please.
Good afternoon, ladies and gentlemen. I'm really privileged and honored to be on this elegant platform. Thanks to the Almighty for that. Respected dignitaries on and off the dais, dear graduates, parents, my dear colleagues and students. As all did, let me first at the outset congratulate the newly blossomed young and enthusiastic graduates and wish them all the best in their future life and every endeavor of them. And let me give, just as Dr. Ajit did, let me give just a few useful tips to you, suggestions to you, which I feel is pretty important when you are so excited and you are jubilantly trying to part away. So this is for you, the graduates. So close your pens and books. Listen to me. This is going to be a 5 minutes class without PowerPoint. Right? Okay. 2 things which is already stressed by GKP Center and our chairman. That is the importance of continuance of 2 things, medical education and medical research. So you might, most of you, not all, will become graduates, postgraduates and super specialists. But that the academic should not end there. You continue. As long as till your body is lowered down in the coffin, the graveyard, you have to continue medical education, right? So you make a practice to in your prescription paper, so right since the beginning, you have to write the clinic a few things about the history, the physical examination. You make a diagnosis, a professional diagnosis, and give a standard treatment. You use medicines prepared or manufactured by reputed companies, not run after the flimsy gifts and offers given by the so-called Chatan companies. There was a series of article in the Manorama a few months back about the Chatan companies, low standard companies. And second thing which I want to tell is about the thing which our honorable chairman told. Many of you may not agree with that. What I feel is it is unfair because you have used the facilities, clinical materials and resources from this college, this place, this state and this country, and for your graduation, post-graduation, and seeking for greener pastures and better sophisticated living condition and handsome salary, you are trying to fly across the globe to different countries. That is quite unfair, or that is what I feel, because we have enough patients here, we have enough job opportunities here, as the chairman rightly pointed out. But of course, you can go to different countries, USA, UK, or Middle East, wherever it is, get some kind of training done, you get some kind of fellowship done, come back to India, and you can impart your expertise and excellence to the poor population, the population of India. Another thing which I want to tell you is, which nobody has mentioned, is just a few minutes back you have already